Ladies and gentlemen, we have with us today Mr. Sohail. Sohail is about 20 years old and he is a slow learner. Now I would like to clarify that when we use the word or a terminology slow learner, it applies to two kind of persons. One category is when there is organic brain damage, such as in cerebral palsy or maybe in Down syndrome or a similar condition, and others are those who are physically and mentally okay, but they have few learning disabilities such as dyslexias. He is a very mild case of cerebral palsy. My suggestion to him is that people with a mild cerebral palsy, they should go to a normal school till such times that they can really be accommodated in those classes. And once they cannot continue in those classes, rather than going for a conventional education, they should switch over to vocational training. So Hale came to me after he was in class 7 and he could not continue. And having come to me, we have trained him in vocational trends. And we have found that over this period of 1.5 years, not only his body language is improved, not only his overall orientation has improved, but he has also shown independent living, and he is now able to work with rest of the colleagues. And keeping in mind that his family background, he comes from a very decent family, so those trades which may not be liked by the family or by himself, such as woodwork or iron work, we have trained him in an official work as an assistant of a hospital or an assistant in an office, and he feels very comfortable with that. So my suggestion is that for all those people who have a mental deficit or who have some degree of slowness of mind, their realistic goal should be set, and then accordingly, if they need to be, the first effort should be to mainstream them rather than putting him into special education, where worse than this category of students are already studying. He would not learn, he rather would be spoiled. And once you have done this, then put him into a trade compatible to his liking and to his family status. Thank you.